You're listening to the UBC Medicine Learning Network.
Being active was a way for me to know my limits, know what I was capable of doing. Without that feedback, without that resistance, your own internal, your own fundamental confidence is so tied up to something that you're no longer able to do. I didn't know who I was.
From UBC Medicine, this is The Listen, stories of virtual care in context. I am your host, Dr. Kiran Veerapen, and today, treating chronic pain and building the therapeutic alliance. Whether treating patients virtually or in person, physical and occupational therapy providers understand that chronic pain can be debilitating, isolating, and even eclipse one's identity. Our patient, Samantha, describes the loss of living with chronic pain.
Growing up in Newfoundland, there's a lot of sort of open space, and so we were able to really take advantage of that and really sort of explore. My parents were really engaged in the outdoors, and they passed it along to my brother and me. Running for me has been a meditation for over 25 years. That's where I would breathe in and out, and I would never be able to solve any of my problems running. They would just disappear. And now I can't do that. What replaces that? Nothing. And that's empty.
As healthcare providers diagnosing and treating pain, it is important for us to understand the nature of pain. Physical therapist and UBC clinical assistant professor, Dr. Neil Pearson, joins us to provide a better understanding of what pain is and the difference between acute and chronic pain.
In the medical world, we're pretty much talking about pain as a symptom, and that's all, rather than pain as something that's an entity by itself. Pain is a human experience, and it's not just a medical condition, it's a human experience. And so pain is something that happens all the time outside of the medical arena. Pain is actually a protection mechanism. Its job is to get you to stop or change your behavior. And so if you're changing your behavior in an appropriate way or stopping, normally the pain will go away. But sometimes it doesn't. And this is one of the biggest problems we have within the medical world, is that most of the people coming to us with acute pain get better. It's almost as if no matter what we do. There are some people who say to us, you know what, the pain really has not changed much at all, but you helped me get my life back. And the reason I bring this up is because as healthcare professionals, we're mostly not okay with this. No one's told us to think about this, right? The person comes to us with pain. We think it's our job to make their pain stop. And when what we're doing isn't helping the person to have their pain stop, that's creates shame, that creates guilt, that creates embarrassment. And what we need to recognize at that point is pain is a human condition, and it's not a medical condition that you can just make go away all the time.
As we just learned from Dr. Pearson, pain is more than just a response to a medical or physiological condition. It is a profound human experience. For us, holding on to this idea can provide us with a more empathetic approach to each patient's lived experience with pain. When their identities are stripped away under the weight of chronic pain, patients urgently seek guidance on how they can get back to the life they once led. As Samantha shares, it was at this point that her healthcare journey became more painful, more challenging. Even seeking guidance, she was left with many unanswered questions.
Across all my health practitioners, I do get asked what my interests are, all those sorts of things, but I rarely get follow-up questions. Ask me what that means to me. Ask me why this is so important. And if you could do anything, what would it be? I wish they actually had listened to my story. really fundamentally ask me why these things are important to me. And if you had asked me those questions many years ago, I would have recovered much faster from my injuries. My health would have been much better. My pain would have been less because I would have felt like I was being heard. My thoughts actually counted. I mattered. And I wasn't just a form that was being ticked off. When I feel like my values aren't being met, they're not even being addressed in the conversation. They're being dismissed as insignificant. I lose trust in the person I'm talking to, but I also lose trust in myself.
UBC Assistant Professor and Physiotherapist Roland Fletcher tells us about the importance of building a therapeutic alliance with patients. This personal bond and engagement with the patient leads to better health outcomes and also provides a realistic path to setting and achieving physical goals.
The therapeutic alliance is something that I find very interesting, and it really refers to this collaboration between a patient and the provider and the bond that they have and the agreement on the treatment goals. So it's really almost a central component of patient-centered care. So being empathetic, listening to the patient, trying to really see the patient, being really genuine, being committed to their care, and just developing this trust with the patient. Some of the frustrations that I hear from patients are that they see providers, and really what's missing is that patients didn't feel heard. They didn't feel that they had chance to tell their story. And again, I think sometimes we are trained to glean very specific answers, and we're kind of trained to know what helps us make a diagnosis and what doesn't help us. So we tend to filter these things out with patients. But sometimes I've just listened to patients and I've done nothing and said nothing. And then often when the session's ended, because I've run out of time, people have said, "Thank you, that was really helpful." And I'd always step back and think, I actually haven't done anything. But then I started to realize I have. For some of these people, I've been the first person to just sit down, not interrupt them, listen to their story and just validate them. And that is really important for patients. And sometimes that's what they want. And I think as clinicians, we put all these other kind of thoughts into our head about what this patient wants from me without actually asking somebody. And sometimes patients just want to share their story, feel listened to, feel validated. And if we have nothing to offer, sometimes that's fine too. And patient can accept that when we've listened to them and validated them. It's really amazing to think that having a really good therapeutic alliance not only builds a patient's trust and can positively affect the patient's engagement and participation in treatment or rehab, but also potentially have a direct influence on their pain experience in a positive way.
Tom Kanwischer, a third-year physiotherapy grad student at UBC, shares an important lesson from a patient on paying attention to non-verbal cues that your patient may provide.
I had a really good opportunity to participate in the program that UBC does, the Health Mentorship Program. You're partnered up with a person in the community who deals with a very difficult illness or disease or condition of their own. You're put in a small group with students from other disciplines and this patient, and given the opportunity to listen to this person, and you get to ask them questions about how they dealt with the system. And our particular health partner had dealt with a condition called Ehlers-Danlos syndrome. One session, I particularly remember this person sat us all down, and she had warned us weeks ago that some nights when she met with us over the course of the year, she wasn't going to be feeling well at all and not interested, but she would try her best to show up because she felt that that was really valuable for us to see her like that. And she looks at me and she goes, "You, what's wrong with me?" There was a few seconds of silence as I was thinking, and she says to me, "If I hadn't prompted you with those questions, and if you hadn't seen me, in the previous meetings, you wouldn't think there's anything wrong with me. But I can tell you right now, I'm in 9 out of 10 pain. the last place I want to be right now is here, not just because I'm in pain, but because of all the previous visits I've had with healthcare professionals who didn't listen, didn't believe me, didn't really care to find out how I was feeling at the time. And I think one thing that she did say after that was, you need to pay attention not just to what someone says or how they or what they answer to your questions, but how they look, how they answer, and how they position their body. So it's really important to really pay attention to what their body and their voice is doing.
Although Samantha's healthcare journey has been a challenge, virtual care has opened up new possibilities. Samantha shares how virtual appointments have not only made her care more accessible and safer, but also have allowed her provider to discover an issue that may never have presented itself during an in-person appointment.
I developed a relationship with a physio purely online in the summer of 2020. During our first meeting, I asked questions, and she was honest and she was great. And I don't know if I would have asked those kinds of questions if I was in person. And it really, really set the stage for a great relationship. And the fact that she was able to identify a posture that exasperates my pain, it was mind-blowing that she could identify something that no one else had. And that's because she only had my head to look at, my torso to look at. I was just so amazed. And from then on, we've had many sessions together, all online, all virtual.
It's a really great experience. I feel like I can talk to her, I can ask her lots of questions, and fundamentally, I trust her.
While virtual care is challenging for hands-on disciplines like OT and PT, it will continue to have a place in their care. Professor Roland Fletcher leaves us with some important thoughts on how we can provide effective care virtually.
So I think virtual care works very well for working with patients where you want to develop a relationship with. Some of the challenges I've found are that as physios, especially, we need to do certain tests on people for depending on their conditions, their complaints that they're coming in. We're a very hands-on profession, and there's a lot of benefits to things like therapeutic touch. So obviously there are things that we miss out on. I think for the large part, though, there are a lot of conditions and presentations that can be managed well with virtual care. Again, a lot of the patients that I see, I might see them in person, do an assessment, and then the rest of that time can be, the management is really through conversation, education, direction of exercises, which can be done well over the internet. I've myself, in my clinical practice, I've recorded kind of common exercises that I use for certain conditions that I typically treat, so people can go online and watch demonstrations as if I was there in person demonstrating the exercise to them. And they can watch these ahead of time or afterwards, and then I can watch them perform the exercise virtually to make sure they're doing things right. We can discuss what happened to them. So I think there's a lot that we can do over virtual care, but I think that one of the key things is that we can still build that therapeutic alliance. We can spend the time listening, being attentive. It involves, I think, a little bit more difference making sure you're looking at the camera. Sometimes I find if you have a big computer screen, you're looking off to the side. So trying to keep your eyes focused in the camera so the patient knows that you're actually looking at them, even though you might be looking at them on screen, but your eyes are directed elsewhere. So, but overall, I think it's a great medium for building a therapeutic relationship still.
In the end, we want to help our patients who are suffering from chronic pain. Virtual care is just one of the many ways to connect with and care for your patient. Listening, building a therapeutic alliance, providing community resources are all tools providers can use to engage their patients. With empathy and empowerment, whether in person or across distance, we can move toward better health outcomes and more meaningful patient experiences. I am Dr. Kiran Veerapen. This has been The Listen.
This has been a presentation of the UBC Medicine Learning Network.